Live, the news on NBC6 starts now.
Well, tonight the CDC recommending booster shots for kids 12 to 15. Their advice coming as the CDC finds itself facing backlash over some of its recommendations. NBC6 reporter Julie Leonardi is live in Miami tonight with the details. Julie.
Yeah, Juwan, and they're recommending this 5 months after those kids get their second dose. So tonight we spoke to doctors who say it's unclear now and too early to tell if the age for boosters will eventually go even lower. The CDC now recommending kids 12 through 17 get boosted. They now say it's important for that age group to get a third shot of Pfizer at least 5 months after their first and second doses. This comes after the FDA approved the shot on Monday. And now doctors here in South Florida say the combo of flu and COVID in kids is on the rise.
Especially how contagious the Omicron variant is, I'd expect it to happen, actually.
Flurona is now the term being used to call the co-infection that we may be seeing more of. But right now, doctors tell us it's too early to tell the severity this combo could cause.
We're not surprised by it. Definitely something we see commonly in pediatrics is co-infections with a couple of viruses or a virus and a bacteria. So it's not something that surprises us.
Doctors say it's something to keep an eye on, especially with kids who don't have their flu shot or are too young for the COVID vaccine.
We're seeing kids that are between 6 months and 5 years of age, the younger kids that are being infected and having to be hospitalized. And also we're seeing those with special needs that are being hospitalized at a higher rate than we had been before.
At Kids Medical, they say there's about a handful of kids already diagnosed.
Speaking to my emergency room colleagues, they have seen some cases on the respiratory viral panel that kids were positive for both coronavirus as well as influenza.
Though it can be tough to identify which virus you have, doctors say now is the time to get your flu shot if you don't already have it, as the peak season continues through March.
Definitely people who are at risk for severe coronavirus infections.
Meantime, the CDC still under fire for sending mixed messages for isolation guidance, cutting quarantine from 10 days to 5. And not recommending a negative test before emerging. Health officials speak to the confusion.
I'm very concerned about the CDC towing the line of whether or not we're basing our guidelines on supply, whether we're basing our guidelines on economics, or whether we're basing our guidelines on science, because it always should be rooted in science.
Though the CDC did not originally recommend a negative test when you're leaving quarantine, now they say you need one. Live tonight in Miami, Julie Leonardi, NBC6 News.